My name is Dr Alison Cave and I am the Chief Safety Officer for the UK Medicines and Healthcare Products Regulatory Agency, or MHRA. The MHRA works to ensure that medicines and medical devices that reach the UK public and health services are safe and effective. We wanted to highlight extremely important safety information concerning the use of nebulizers for treating asthma attacks in children. These medical devices can be used in some circumstances to treat asthma emergencies, for example, in hospitals. But we have received reports that they are sometimes being used for treating asthma in children at home without being recommended by an asthma specialist. Using a nebulizer can sometimes mask symptoms of worsening asthma, and the child may become seriously ill. So with the help of experts in asthma, we have developed this video to provide information to patients and carers on this very important safety issue.
I'm Dr Rebecca Mann and I'm a consultant in children's health. I want to talk to you today about using medicines to safely treat asthma attacks in children. When a child has symptoms of an asthma attack, such as coughing, wheezing, or a tight chest, the reliever inhaler, which is usually blue, is the best treatment, and it should be used with a spacer. This is important because inhalers get the medicine to the lungs where it's needed. If a young person's asthma is well controlled with their preventer inhaler, which is usually brown or beige, they shouldn't need to use their blue inhaler very often or at all. However, they should always carry it with them in case of an asthma attack. If a child has symptoms of an asthma attack which are getting worse and their blue inhaler hasn't helped, please call 999 immediately. Sometimes people mistakenly think that it's better for children to use a nebulizer to take asthma reliever medicines instead of a blue inhaler. Nebulizers can be used by people with lung conditions such as cystic fibrosis, and they can also be used in ambulances and in hospitals to treat the most severe asthma attacks. In rare cases, an asthma doctor might recommend that a young person who's unable to use a blue inhaler properly, for example if they have trouble using their hands, should start using a nebulizer at home to take asthma relievers. This doesn't mean that nebulizers are suitable for everyone. You need to be aware that a child using these nebulizers without medical advice may feel well, but it can be harder to spot signs of their asthma getting worse. There's a real risk that asthma can worsen very quickly and the child become seriously ill or even die in very rare cases before emergency help arrives. This is why you are not recommended to buy a nebulizer to give asthma reliever medicines at home to children and young people unless you are specifically advised to do so by an asthma specialist. If you are already doing this without medical advice, please speak to your GP or asthma specialist as soon as possible. They can advise you on the best treatment for your individual child's asthma. We are also asking schools to be alert for children who say they're using a nebulizer for their asthma relievers at home. Please make sure parents and carers understand that they should only do this if it's been recommended by a doctor.